All right, it is 12 o'clock, so we are going to get started. I'm going to share our slides. Welcome, everybody. My name is Rebecca Nevadale, and Macrina, do you want to say hi?
Hi, I'm Macrina Leach.
We are both with Chappie. Today is November 11th, 2021. So if you are watching a recording of this webinar, some of this information might be out of date, so be sure to go to cdc.gov for the most up-to-date information. And we want to start by wishing you all a really happy Veterans Day and giving our thanks to all of you who are vets. This is it's always a great day, Veterans Day. This year's parade in my town in Phoenix was led by a public health veteran. So someone who's been a part of our public health workforce for many years. So we know that many of you have served and are so appreciative of all the sacrifices that our active duty families make. We all start all of our tips with just kind of a recap of where we're at with the state of the pandemic. And unfortunately, our cases do continue to increase. All counties are struggling through this, especially our rural communities. So we are really here to support you, especially we've had 1.2 million cases since the beginning of the pandemic. And sadly, 21,549 Arizonans have died of COVID-19. The number of COVID deaths actually surpasses the number of deaths for Arizona for cancer and heart disease. This is our #1 leading cause of death in Arizona right now. Kids are our hope for the future for everything, right? We know there's lots of pediatric folks on the line. And when it comes to the pandemic, this truly is our way out and our way back to normalizing and being able to live with this new disease. So we are just so excited that we've gone down to H5. I'm sure many of you have hopefully reconnected to a little bit of the passion of why we're all working so hard to do this, because as someone who for the last year has been doing vaccine for adults, going back to events and walking into practices and seeing excitement in the air, seeing people not complain about having to wait, just the relief of parents that their children can freely go to birthday parties again, can participate in sports, can hug their grandparents, has really helped reconnect us to our why. So we hope that you're all feeling like that too. But we know some of you are still not sure if you're going to be able to offer this vaccine in your office. So Macrina, tell us what this box is. Oh, there you go.
I'm unmuted. So this is actually the size of the Pfizer vaccine for our 5 to 11-year-olds. Or 5 through 11-year-olds. This box is actually the exact same size. This holds 100 doses. This is the exact same size as your box of Tdap that holds 10 doses, or any other box that holds 10 dose vial, 1 dose, 10 vials, if that got it clear. So really you will have space for this.
Yeah, it's smaller than you think.
It is much smaller than you think.
Yeah, not that you're not still full of flu and all of the other childhood vaccines, but we hear all the time, I just don't know if I have the space, but 100 doses looks this small.
Yep, and that's in our fridge right there.
There it is. So remind us who gets what.
So currently, Pfizer is the only vaccine that is available for 5 years of age up. There is no vaccine authorized for any child 4 years of age and younger. And both Moderna and J&J are only available for 18 years of age and older. So those are only for the adults.
So you should not be immunizing anyone who's 4 years or younger. Pfizer for 5 to 11 only. Pfizer for 12 to 17 only, and 18 and up gets to pick what they want. but obviously that dosage is different for Pfizer for 5 to 11, and we'll review that today. So many of us vaccine nerds watched the ASIP, the ASIP approving this. But we wanted to just start with why this is so important. And for those of you who don't watch ASIP hearings all the time, to be able to tell you a little bit about the kinds of data that they looked at to make this decision, because we know that your families are pretty confused. So first off, we do have a lot of data on effectiveness for Pfizer for teens. So for 12 to 18-year-olds, vaccine reduced the risk of hospitalizations 93% when compared to the unvaccinated population of 12 to 18-year-olds who did get COVID. Adolescents who were hospitalized with COVID were 97% of those adolescents were unvaccinated. And no adolescents who are vaccinated have ended up in the ICU. And this was before, when did they meet? When did they meet?
They met November 2nd and November 3rd.
Yeah, so this is a little bit dated. That may have changed since then, but this is an incredibly effective vaccine for our 12 to 18-year-olds. The other thing that ASIP looked at was incidence of COVID-19 in that population of 5 to 11-year-olds. So on this graph, our 5 to 11-year-olds are the blue line. So you'll see them there on towards the bottom of the graph. But so when you look at that rate compared to the rest of the population and age breakdowns, it looks like, hey, our kid's not getting this. But I think that in pediatric practice, especially more than most, except maybe our friends in education, all of the things that go into a parent's decision of whether or not to get their child tested. Those 5-year-olds are kind of gunky and snotty anyway all the time. So it may just not be prioritized for a family. And maybe there is something about them getting lower rates, right? Maybe 5 to 11-year-olds don't get it as bad or don't get it at all. Well, they do get it at all, but we want to help remind you to put this in perspective, that there are almost 2 million cases of COVID-19 for children ages 5 to 11, just from March to October of 2021. So that's not even a full year. Common year for whooping cough is 10 to 50,000 cases for the whole year. We don't even go near 2 million cases of flu in pediatric population per year. So this is, while compared to other groups, maybe not as common, it is still incredibly more likely than other diseases that impact kids. So this was having an impact on our healthcare system, as you know, which ASIP definitely takes into account when they decide. They also, at the time, because we're starting to vaccinate our older folks, more younger people are making up a larger piece of the pie for COVID-19 cases. So the other thing that ASIP looked at was they looked at all of the jurisdictions where they have vaccine programs. So people who they give money to, it might be cities, it might be states, it might be counties, and asked those jurisdictions, where do you think the children are going to receive vaccines in your communities? And they are putting a lot of faith in pediatric providers. We know that that's where families are going to feel most comfortable getting care for their kids. And we also know that for parents who are kind of in that wait and see, that maybe they're not incredibly hesitant, but they just want to give it a few weeks. The thing that's going to put them over the edge is having that conversation with their child's doctor or nurse, or someone in that practice, to be able to help them feel confident making that decision. So as you know, there's a lot of resources going in to our pediatrics, but the reason why is because CDC funded lots of research and found that what we already knew, well, those of us who work in this already know, people trust their kid's doctor more than anybody else. So screening. Let's talk about, Macrina, what are we screening for kids?
So the first thing is, one One question we've got asked by a lot of parents is, well, you know, my 11-year-old is pretty big, or my, 14-year-old is tiny, or, my child is really mature for his age. We've gotten all sorts of questions asked, and this is not unlike any other vaccine. Vaccines are based on child's age, not their size, their weight, their maturity level, height, whether or not they're in the honors class, nothing. This all is just like any other vaccine. It's based on age. And the other, which I think is the most popular question we've been asked since day one, is if a child turns from 11 to 12 years of age in between the first and the second dose, what vaccine should they receive? Well, as long as they're 11 and younger, they're going to receive the orange cap, which is the 10 micro units of vaccine. If they turn 12 in time, if they turn 12 if they need their second dose and they have turned 12, then they're going to get the 12 and older vaccine. So you're going to immunize them based on their age, not on which vaccine they originally received. There's also been a lot of questions from parents about, well, my kiddo had COVID. What do I do? You're still going to immunize them. What you're going to do is you're going to wait till they actually are out of quarantine and free of fever for at least 24 hours or symptoms for 24 hours, and then you can go ahead and immunize. There is no recommendation for serological testing. So there's no reason for parents to go out and see, well, if my child had been infected with earlier, there's no need for that. Again, out of quarantine and symptom free for 24 hours, and they can go ahead and get immunized.
Yeah, we get asked a lot about another thing that I hear all the time is this authorized for young children? And the answer is yes. So we wanted to make sure that you remembered that is like the message that we need to lead with families, that yes, this is authorized. So the difference between an emergency use authorization, which is what children are covered under, right? 5 to 11 vaccine.
Right.
And the 12 to 7 to, is it 12 to 15 or 12 to 17 that's under EUA?
It is.
Now that I say that out loud, it might be 12 to 15. Can we check that, Jen?
Yeah, I don't know. I thought it was.
Or Laura or someone, I'll just start calling names out. Tappy people, check so we can make sure. But the difference is for full authorization, FDA, in order to give full authorization to things, wants to have some sort of longitudinal efficacy data. They want to be able to say that this vaccine is going to last for 10 years or 4 or 5 years before you need a booster. So we just haven't had the data catch up to us yet to be able to get that EUA for 5 to 11 or 12 plus. But obviously for adults, they are under full authorization. The other thing that we're getting asked a lot by pediatric providers is, where's the VIS? There is no VIS for this vaccine. You are offering instead the fact sheet for healthcare provider, it's actually the fact sheet for parents and caregivers, and we'll make sure to throw that link in there. It's like 8 pages long. We know you don't want to have to print that. You don't have to print it. You can just offer it, have a few on hand, and Tappy has some QR codes and postcards or posters and things you can print out or order from us for free if you want to place those in your waiting rooms and things like that. So Jen just threw that in there. And there's a question, a couple questions in there before we move on about age, Macrina. So I'm going to make sure that we get those. So Sarah's asking, so if a kid gets it 2 weeks before their 12th birthday and they get the orange cap, the second dose would be a purple cap, correct? Right?
Correct. And you know what the best way to talk to parents about the EUA is I say, well, they know it's safe, they know it's effective. Just like adults, with kids, they don't know whether or not they're going to need a booster because they don't know how long it's going to last. That's the only thing they don't know, and that's why it's under emergency use authorization. And most parents are like, yeah, okay, I get that.
Right.
Because that's the way it is with adults.
So And Rosemary's saying we may have indicated something different last time, at which it may possibly, I mean, that's certainly possible, but now that everything's actually approved and released, it's CDC's recommending that you get the product for your age. So if you start with an orange cap, it doesn't necessarily mean you end with an orange cap if you turn 12.
Correct.
Yeah. And actually, if you, that kind of, I do think a lot of people are only offering 5 to 11, and we'd be curious to see if, I want to make sure, if you're in Maricopa County, at least, remember that you can order fewer than 1170 of those big Pfizers to keep some on hand. So we'll make sure to review that at some point today too. Remind me, Macrina, to go over that. I don't want to get too far off topic, but it's probably a good idea to keep some 12-year-old ones there. Prep and storage, orange cap.
Okay, so the orange cap, again, 5 through 11 years of age, you're going to dilute it with 1.3 mils of sterile sodium chloride. And the sodium chloride, the diluent and the syringes for both administration and the syringes for diluting the vaccine and a few other supplies will come to you in an ancillary kit. And usually the ancillary kit's delivered a day before the vaccine shows up. Once you dilute the vaccine, you have 10 doses per vial, and you're going to pull up 0.2 mils per dose for those kiddos. Okay, so vaccine storage. This one is a little bit different than the purple cap. Well, actually, it's a lot different. So the orange cap with the orange bordered box is going to show up on dry ice, and it's going to be in that sub-frozen temperature. For anybody who has an ultra cold freezer, you can keep it thawed until the expiration date. If you do not have an ultra cold freezer, which I'm assuming most of you don't, when you take it out of that ultra cold carton, you can put it into the refrigerator, and it is good for 10 weeks. Once your vaccine is in the refrigerator, you cannot refreeze it.
So there's one question, do we pre-draw the vial, all vaccines in a vial, or do we do one at a time?
You can do one at a time. There's no need to draw them up all at once.
Okay, but unless you're doing a big event.
If you're doing a mass vax, clinic where that's all the only vaccine you're giving and you're having people coming, hundreds coming in at a time, then you can definitely draw them up all at once if you'd like. But if you're just using it in your practice as kids come in, you can just draw up one dose at a time.
So how do you store it while you're using it?
So the difference with this vaccine is once you dilute the vaccine, you can actually keep it for 12 hours. After dilution, it should be held either in your refrigerator up to room temperature, again, for up to 12 hours after dilution. The vial, this is really important, the vial and the box will say 6 hours. But the information in the emergency use authorization fact sheet for providers supersedes the information that is printed on the box of the vials. So again, once the orange cap is punctured, it is good for 12 hours, which gives you 12 hours to administer 10 doses.
So they're not looking at the box, they're looking at the fact sheet.
Correct, for this.
Okay. Yeah, that's super important. Hopefully that changes.
Hopefully on their next printing of the box and the labels, they will change that information. But I think it's caused the most confusion.
Mm-hmm. Yeah, like when they first started getting them, everybody kept asking, is this expired already? No, look at the.
Right, because it's the manufactured date that's on the file.
Anybody have questions about storage and handling for the orange caps? I think we got to everything in the chat, but anybody else have something? You can feel free to unmute yourself if that's easier. All righty, then let's move on to poking them.
Okay,
Administration.
this is given IM in the deltoid. I'm just going to show you a different therapeutic positioning and hold than we've shown in the past. We found this to be a little bit more successful in some instances. Again, it's IM in the deltoid, just like any other, lot of other vaccines we give. Okay, who should not get the vaccine? The contraindications for this vaccine are the same for 5 to 11 as they are 12 and older. If anyone has a severe allergic reaction to a previous dose of the vaccine, or has a severe allergic reaction to any component, the one that they have seen create the most severe allergic reactions are polyethylene glycol and polysorbate. They're both found in over-the-counter medications. Some of them are found in injectable medications, and some are found in some vaccines. So that's why we always just ask, do you have any allergic reaction to an over-the-counter medication, to a previous vaccine, to a previous injection? Because if someone has an anaphylactic reaction to any of those, it definitely could either be that PEG or the polysorbate.
So is that screening questionnaire the same, or is it being updated?
Well, they need to update it because it doesn't have the new age range, but the screening questionnaire is the same.
Okay.
So if some folks are doing 5 years of age and all the way up, you don't have to have multiple screening checklists. You can use the same one for everybody.
So a couple administration questions that we've gotten, and I see Sherry asking in the chat, do they have to wait for 15 minutes after the shot? And the answer is yes, that's the recommendation, to wait for 15 minutes, 30 minutes if they have, what's the qualifiers for 30 minutes?
So the qualifier for 30 minutes is, do you carry an EpiPen? I mean, I think that's the easiest, way to ask that question. If a parent or an adult carries an EpiPen because of a severe allergic reaction, and it doesn't matter what it is, then they need to wait 30 minutes.
Yeah. And we know
having immunized somebody who's allergic to bees and carries an EpiPen. Yes, Rebecca, she had to wait 30 minutes while her entourage who came with her only had to wait 15.
Yes.
Yes.
If you draw one vial, can the vaccine be given by a staff member other than the person who drew it up?
Yes. If you are doing routinely, that's a practice we do when you are doing maybe a mass immunization clinic, where you know you're only administering one vaccine.
That is, I wonder if I'd be curious if anybody who's in private practice can chat in, if there's a glitch with your EMR or your billing software, if that's any tips that you might want to give that practice. Can a filled out syringe sit in a room temp for any amount of time?
It can sit out up to 12 hours. We don't really recommend setting them out that long because we just find that it just increases your risks of errors or not having it labeled well. So if you're going to draw up multiple doses at once, make sure that you can use them within a shorter period of time.
And does the parent sign the vaccine record? I assume that means the card. I mean, they sign for consent like they do for every other.
Yeah, they would sign for consent, whatever consent system you use, but the parent doesn't need to sign the record card.
Mm-hmm.
That would just be wherever you practice. I don't know. For the county, we just use a stamp. I've seen a lot of immunization records from practices come with just a stamp.
Mm-hmm. I wonder if parents will be better at keeping these than they are the blue books, but I don't know where mine is. So, okay. Can I co-administer with other vaccines is a question we get a lot. Yes, you can.
Yes, you can.
This vaccine can be given with all others. We are doing a lot of flu and COVID. So pick your arm of where you want what. We also get questions, and this is from people who are newer to the vaccine game, or maybe are used to vaccinating adults and not children. How do you support families with sensory challenges? And this is something we'd love if there's pediatric practices that have your own policies or things you found helpful, please put them in the chat, because we're asked this all the time. But the big thing is, have in your workflow a quiet, dark room, if possible, where those families can be directed, and make sure that you leverage those parents. Those parents have gotten many vaccines probably before, and they know, listen to them. They probably know what's going to calm their child down the most. They might also know different comfort holds and ways that they've worked with the providers in the past to make sure that they can safely immunize that child. If it's okay with the parent, be sure to grab a friend if that's what's needed to make sure that the hold is appropriate, and that everybody can be safe. But we really need everyone to try everything possible. It will take more time, but try everything you can, because those families oftentimes have been practicing that for weeks and gearing up for it. So what looks really like atypical to you is probably typical for that family, and they've worked really hard to get that kid in there. So let's try and make sure that we don't miss that opportunity. And another question that we get around administration is, can I administer to the whole family? And the answer to that is absolutely. Yep. We know that those 5-year-olds come with grandparents, aunts, uncles, neighbors, everyone. Vaccinate everyone who's due, as long as they qualify for that vaccine that you're offering. So
yeah, a lot of the events that we did this last weekend to sort of kick off the 5 to 11, we saw a lot of adults, a lot of parents who waited to get vaccinated until they could vaccinate with their kids. We saw some grandparents coming for booster doses. So COVID vaccination does seem to be more of a family event.
Yeah. We saw a lot of kids running up and down bleachers, which the folks who aren't used to kids are like, no one's in a single file line. And we kept saying, these are families. Yeah. No one's going to be in a single file line, but they were all really happy to get their vaccine. We're going to make sure that we get to coding in just a minute, Sherry. So we are not required to give EUA forms like we give the VIS forms. You are required to offer the EUA form, just like you are required to offer the VIS forms. You're actually not required to give the VIS either, are you?
No, you make it available.
Yeah, you just have to have it available. So,
right.
Yeah. I think Maria is probably doing a celebration dance about all the paper and trees she's going to save if they're still printing out VISs. That's a common, that changes all the time. Are we okay to open a vial for just one kid? I want to make sure we talk about some kind of counseling things, but yes. Yes. This is so different, this federally provided vaccine, than all the other vaccines that we work with. Do not waste an arm. You are not going to be punished for wasting those, for any of that wastage, if it means that you got one of those vaccines into an arm. This is very different, but we really want to make sure that we have no missed opportunities. Obviously, do everything you can to try and use all the vaccines in a vial, but you don't have to. You don't have to.
Right. You don't have to turn somebody away just because you don't want to puncture a vial at the end of the day. Mm-hmm.
So we have, this came from CDC too, when ASIIS was looking at approval, their data is showing that 37% of parents say their reason of parents who do not want to get COVID vaccine for their child or are still on the fence or considering, 37% of them said it was because they're worried about side effects. And this is really not much different than any other vaccine. No. So we think that you are all pretty good at putting those side effects into perspective, but we know that you're also asked a lot about about side effects for this particular vaccine. So Macrina, what did we learn from the clinical trials for kids? And remember, kids in Pfizer land is under 16.
Right. So what we discovered is that children 5 to 11 years of age during the clinical trials actually only reported 2.7% of the participants had any reactions, systemic reactions. It was actually higher with the 12 to 15-year-old. So from the clinical trials, we've seen that those systemic reactions are actually less. And when we look at the data from VAERS about adult adverse events, what we really saw were the biggest ones were sore arm, some fatigue, some headaches, some kind of weakness, not feeling real good, chills, fever, is really what we saw with adults. So we probably wouldn't be shocked to see some of those with our younger kiddos, but the clinical trials said that they were significantly less. So the best thing to do is what we always do with parents after we immunize kids, is just let them know what they may see and what to expect so they're not surprised. I think when it comes to those reactions, I think the best offense is to have a really good defense and just kind of explain to them what they may expect. And then if they don't happen, they're really happy. But if you don't let them know what may happen, then if it does happen, then they're really sad. So right. Again, just be honest. But again, during the clinical trials, we've seen less.
Yeah. So what's cool about this, which you'll obviously get these slides, but this shows on the bottom, it's from actual VAERS reports from adults. Right. So, it's about on the day one, about 73% of us are having injection site pain. On day two, about 80% of us, like that's what you're going to be able to expect to prep your folks for. And this did, if it's anything for kids like it was for us, it did hurt. Like my arm was more sore than it normally would have been. So it was good to know that ahead of time, because I probably would have ended up bothering Macrina otherwise, or calling my pediatrician.
Well, I think we also need to take a look at this that just from what I've seen with actually immunizing folks with all vaccine types is that Pfizer seems to be a little bit less reactogenic than Moderna. And Rebecca got Moderna. And even though my arm was really, really sore, I think I had less reactions than Rebecca did. Of course, older and my immune system may not have responded as well, but so yeah, just kind of keep that in mind. And let's review, because we have the purple top and the purple label and the purple. For 12 years of age and older, you dilute it with 1.8 mils of the sterile sodium chloride. You get 6 doses after dilution, and you give 0.3 mils. The storage and handling is different for this vaccine as well. Again, you can keep it until the expiration date in an ultra cold freezer. And if you do order the doses directly through ASIIS, they will come in a thermal shipper with dry ice, or they can be stored in the freezer for up to 2 weeks. And then undiluted vials may be stored in the refrigerator for up to 1 month. After you dilute this vaccine, it can be stored in the refrigerator. It can be stored up to 77, which is considered room temperature. But the entire vial must be used within 6 hours of the time of dilution. You want to minimize exposure to room light and all that good stuff. And you've got to discard after 6 hours and do not refreeze. I think this is probably the most difficult part of both of these vaccines, is just understanding that they both have different time frames. Once diluted, they have different storage and handling guidelines.
How are you handling that? because you're offering both at everything that you do, right? In your clinics, at your events, your drive-through. Okay.
Right. So what we actually have done is we bought pencil boxes. They still make pencil boxes. And we put the orange in an orange one. We put the purple in the purple one. We make sure that they're really labeled. And so once we puncture a vial, it says right there, we write the time. And then we write the time that it needs to be discarded. We do the same for the purple. We do the purple and the orange. It does take a little bit more. The logistics is a little bit more complicated.
Yeah, but you will be surprised how many arms over age 12, you might be able to get, especially in, I think, private practice settings. So,
well, I think the whole idea is just to come up with a process and system that works for you and your practice. My folks came up with a system that works best for them, so they can ensure that they decrease the risk of having an error.
Yeah.
But whatever system, and you guys know how to run your offices and how they function. So the best thing to do is come up with a system that works well for all of you. Make sure you document it, write it down. And then that's really going to be helpful.
Can you administer in the leg?
Not recommended to be administered in the leg. Just like any other vaccine once a child is up and walking. But again, there may be medical issues where, for example, we had a woman who had a double mastectomy and had lost all lymph nodes. And so the recommendation was to administer in the leg. So there may be some rare situations, but your everyday routine immunizations, no.
Any other questions that are not billing or reporting related? Because we're going to have Jen go over all that. Do you mix vial before dilution and then after, or just once?
Oh, so when you take it out, you just do it once. After you do the dilution, this is the vaccine that you do this with 10 times. You just hold it and you just do this 10 times.
Oh, that's right.
I know. It's very, this is the only modeling I'm going to do. Just this. Don't shake it. Don't agitate it. Never shake it. This is a very sensitive, delicate flower.
Yeah. All right. So Jennifer, tell us about reporting. There's lots of questions. And can you make sure to go over the ordering process as well? I don't know if that's on our slide, I forget, but can we go over ordering? And then when you talk about reporting wastage, if they have to. Take it away.
We can do
now that I've
all
told you everything you must do.
all that.
Yeah.
So, okay, I thought I would just start from a little bit about how the system works. So the CDC sends ADHS the number of doses for Arizona. The offices order directly from ASIIS now. So for this one, you just go straight into ASIIS like you would for your VFC or your VFA vaccine. ADHS approves those doses. You have to accept the approved doses, and then they're shipped directly from the CDC to your office. Once you administer those, you have to report them to two different places. So you report the patient record to ASIIS, that has all the patient demographics and which dose that you gave them. And then you report the doses given and the number of appointments that you have coming up to the vaccine finder. And you have to do that every day, even days that your clinic is closed. So unfortunately, you guys have to do rock, paper, scissors to see who's going to do days that you're not in. So every day
That's what I was going to say. And it's every day to ASIIS as well. That's different than
it is.
Yeah.
Yep. So that's very different than what you typically do. So it's every day that you report the patient record and every day that you report to Vaccine Finder. So the patient record is every day that you give a shot. Vaccine Finder is every day, even if you didn't give any. So here's kind of the lowdown on that. So to vaccines.gov, doses on hand daily, and then to ASIIS, patient records should be done daily, or they give you within 72 hours. If you've had a mass vaccination site, for instance, on Saturday, and you're not able to get the data entry in or to upload that to your main system, you might do that Monday morning, but it has to be done within 72 hours. And so typically for most childhood vaccines, the Arizona requirement is within 30 days of a dose given. These are CDC federal requirements, and it's based on the contract that you signed to be a COVID provider. So it is very different.
And then,
okay, so yeah.
And then for ordering, there were a couple questions around. So we are ordering through ASIIS now for everything, but you can order, Macrina, what is, for those who are in Maricopa County who want to get fewer than 1170 big Pfizers, what do they do?
So we do have a form that you could complete to order the 12 plus Pfizer that only comes in 1170 in ASIIS.
So we'll send that when we send the follow-up stuff, email with all the slides and here's where you find everything. We'll make sure to put that information in there. And
yeah,
also,
we do have minimum doses of 96.
Then while we're talking about it, I was saying, let me skip ahead real fast to the Matchmaker. Do you all post your stuff up there, Macrina?
Yeah, she does. Somebody does. Yeah.
Somebody does for us. I don't.
Yes. So ADHS has come up with this vaccine Matchmaker app. So if you have extra doses that you don't think that you're going to be able to get rid of, or if you need vaccine, you could go on the Matchmaker app and you can see the number of doses, which are listed here as soon as you open it up, who has extra doses and which brand they are, and then you can request that transfer kind of back and forth. You can also do this with syringes too, or any other of the ancillary supplies that you might have run out of. You can post it up here that you're looking for it, or that you have some extras, and order them from there. So the vaccine Matchmaker app, and I think most of the counties are trying to put on there if they've got those extra doses, so we can use Macrina's link, which we'll find, and the Matchmaker app, they have those doses on there as well.
Thank you.
Sure, I'll skip back because I think this is the most important piece, is the don't waste an arm. And this is very different from what a lot of you hear from VFC and concerns about wasted dosage through the VFC program. For COVID vaccine, it's too expensive to make a single dose vial. So they're not going to be making those at all. They're just going to continue to do them in a multi-dose vial so we can get it out as quickly and as cheaply as possible. Currently, there are millions of doses in the US, and we're sharing with a lot of other countries as well. So if you have one patient in a day that you finally talked into getting a COVID-19 vaccine, give that one patient one dose and toss the rest of it away and report it as wasted dosages. There is no mechanism to have you all replace the doses. So for instance, on a VFC program, you might have to go purchase private stock if you have an excess waste and replace it. There's no mechanism. You can't buy this from the private sector. So you will not be charged for it, and it will not count against your VFC percentage. So COVID's a totally separate program, and don't waste an arm is the ultimate guide that the CDC is giving at this point. We want to make sure everybody's covered. So that, I think it's good news. And I know a lot of people were concerned about it. So then there's reporting of administered doses. And for those of you who are just doing pediatrics, you're not going to have this particular problem yet. But if you're giving Moderna to adults and you're giving those booster doses, you have to report that as a half dose. So ADHS has some guidance on how to do that by HL7 if you're connected, your EHR is connected to ASIIS. Or if you do it manually, you have to go down and say dose size on this Moderna and do a half dose so that it decrements your inventory correctly. They also have some guides about how you do a wasted dose. So here you can see they've got this little chart of half dose and full doses. You can't puncture the vial any more than 20 times. And so that's also contributing to how they count those wasted doses. So they've kind of got those lined out, and they have a guide to help you see how many times you've been able to puncture it, how many half doses were given versus full doses, just to kind of help you guys track those for Moderna. And we know those are pretty tough. And on the handouts for today, we've got all of the links to all of the tools that ADHS is putting out for these.
So there's a couple questions. There's a couple things about ASIIS and stuff in there, but why don't I think keep putting your questions in the chat, and we'll just have Jen go through everything because she's hitting some of it and then go back and ask them. So keep putting them in there, but.
Yeah, and this is such a complex vaccine, so all the codes make a difference with ASIIS, the timing, the arrangements, so maybe some of it will get clarified as we go. But the other big thing that you're hearing from patients is, I lost my record and I can't find it, how do I get another one? So ADHS currently has two methods to do that. They have an immunization record request form where the patient can go in and fill it out and request their record from ASIIS to be printed off and sent to them. This is taking quite a while because it takes a person going through it all, verifying that the patient is who the patient is, and then getting the record. We also have, ASIIS has an app called MyIR, which if you all have been able to put in the correct birth date, phone number, and name for the patient, then the patient can go in and verify that name, address, phone number, all of those pieces, and they can pull their record straight down into an app on their phone. It's called MyIR. It's been out for a while, and before, if you guys used it before and said, no way, it's not working, before it only had about a 25% match rate, and it's up to 60% now, and getting better all the time. They also have a little chat function that the patient can go in and say, hey, I can't find me, what's going on? And they'll try to help find out what the problem is. So this might take some of that, you know, those questions out about which vaccines they got and when they're due for a booster. So on to billing, which is so confusing, and I'll go through it very quickly, but
Hey, Jen,
yeah.
Let's clear up some of these non-billing things first before people start worrying about their billing stuff.
Okay.
Oh, so do we submit it the same way as we submit it for, do we enter into ASIIS the same way that we enter every other vaccine?
If you're manually entering, yes. If your EHR is connected to ASIIS through HL7, there are some different guidelines that some EHRs on the childhood vaccines will send it in batches, like once a week or once a month. You have to make sure you change your batch rate to send daily for a COVID vaccine. And there's HL7 guidelines. Those links are in the slides when they're posted for today's presentation.
And if their EMR already dumps all the other vaccines in there, will it dump the COVID vaccines into ASIIS?
It will. Again, make sure you're dumping daily now instead of weekly or monthly.
Okay. If our clinic is not signed up for vaccine finders, do we still have to report?
Absolutely. So on the CDC's vaccine finder, that vaccines.gov, you can opt in or out of sharing your clinic. So you don't have to post it on there as a walk-in clinic, but it has two functions. One is for patients to find a dose, and two is for the CDC to give those, really it's a lot of those daily media briefings they do on the number of doses that are given, but that's how we're tracking around the world. So you have to report the number of doses that you gave that day, so that they can continue to track it to say we've hit 4 million doses, we've hit 76 million doses. That's how the CDC is accounting for all of the doses that are being sent to states.
Okay. All right, I think that's it for reporting. So on to money before these practice managers really give us dagger eyes.
Yeah, well, and the money is good with this one, which is good. I mean,
we know we're making you report, but you're going to get paid.
Yeah, there is recognition that, you know, that the additional reporting requirements, it costs you all more. and it takes more. So the Medicare rate is $40 per dose. The access rate in Arizona for Medicaid kids is $83 a dose. So both doses. So, or booster doses, in fact. So all doses for Medicaid, you bill $83. Medicare is $40. If you do homebound patients, if you take a vaccine to a homebound patient, Medicare will pay $75 for each dose for that. So they are recognizing that this is more complex and it's taking you guys a little bit more. You cannot charge the patient any out-of-pocket cost at all. It's free for all patients. Zero money can be exchanged. So if you have patients that are uninsured or underinsured, meaning their health plan didn't pay the full amount of $40, you can submit that to the federal uninsured program. You can submit those claims for uninsured and underinsured. So if you get underpaid or you didn't get paid, you submit it to the federal government's uninsured program. And there's a link for how to register for those. And on the slides, there's a little bit more information about the two different programs. But you shouldn't be out of money at all or reimbursement at all, even if the patient isn't covered. So here are the billing codes. The highlights for these billing codes is that each vaccine has its own code, and each admin for that vaccine has its own specific code. So typically, if we give a flu shot, we use the same admin code for everybody and every dose. But this is different. You've got a first dose administration code, second dose administration code, and third dose administration code on Moderna. And on Moderna booster, which are half doses, you have a new vaccine code and a new booster admin code that you have to use. Those admin codes, once you've coded it in the EHR, should report that accurately to ASIIS and will be able to bill for that, and the cost is the same. So you can see that these columns have the CMS rate by date because they've been changing those, but it's got the regional rate for Arizona is $38.78 for most private plans, $40 directly from Medicare, and $83 now from Access as of August 9th. So this is Moderna. Here are J&J's, again, a vaccine code, the first dose administration, booster dose administration, new codes. And then Pfizer Purple Cap has its own codes, both vaccine and administration. And then Pfizer Pediatric Orange Cap has its own codes for vaccine and administration. And then next, coming up, which you might as well, if you're planning on continuing to give it, Pfizer 12 Plus is going to have a gray cap ready to use, but it's not here yet, but you can start thinking about getting those codes in your system pretty quickly. So one of the main distinctions as well is you can't just say that you're giving a third dose versus a booster dose. You have to indicate if this is booster or third dose, because third dose immune compromise gets reported to Medicare differently and you use a different code to bill it. So make sure you indicate whether you're giving a third dose to an immune compromised or a booster dose of the Moderna, Pfizer, or J&J now. We have some patient information signs that you can hang up, or you can hand them out as flyers that kind of explain the things that you're asking for from a patient that might be a little bit different from how you bill or what you ordinarily ask for related to the COVID vaccine. So if you need those, we have those. We've also got all kinds of patient education materials and things to help in your clinics, things like that QR code for getting the patient directly to the EUA so you don't have to hand it out to each patient. And of course the trainings, and then some guides of, you know, kind of how to get ready and get set to give the vaccine. So we'll have those all posted right after today, but hopefully that kind of gave you an overview of how we're doing some of the reporting and billing, which is complex.
And did we go over how to report wastage?
So there are links to the wastage form and about how you account for that. And then there's a way to account for that in ASIIS. And quite frankly, I have not seen the update of how they do that. Is anybody familiar, has anybody done it recently to see how it's changed?
Terry saying their little Pfizers are reporting to ASIIS with a red X. Will that be changed soon, Macrina? Or Jen?
It should be changed soon, because when we first started giving third doses and booster doses, those doses also had red X's. So they're working on it, and it will change eventually.
Okay.
But the same thing's happening in the health plans. If you start sending your claims, you're going to notice that they will be bumped out for age or booster doses or too many doses. It's taking the health plans about 30 to 45 days to fully update their systems. So if you get some initial denials, just resubmit. It's taking everybody a while to get all of the systems to talk to each other correctly.
30 to 45 days. That's a lot quicker than we waited for HPV when that was new. That's loaded,
there
so.
have been some improvements.
Yeah.
6
Yeah.
months. Yeah, so they are moving faster, but it's still slower than your claims. So in that first 30 days of any change to COVID vaccine, you know, you've got a high chance for denials.
Anybody else have questions on reporting or billing?
I saw one more question pop up. The private cost or the private reimbursement is around 40. It's $38.70 for our regional Arizona rate, but 40 is the guide. So 40 is the standard, and Access gets the gold star at $83 per dose.
We know that for many of you, you're kind of still getting your heads around doing 5 to 11 or anyone over, you know, or 12 plus in your office for the first time. So we really hope that you fill out that our evaluation is like 3 questions, but we want to know what topic to talk about next and whether or not you need to hear from other practices again. So things that we hear a lot are, where are you sticking these people for their waiting room? You know, for the observation area, we've heard some practices are bringing patients back first and having them get vaccinated before they do the well visit, so that they're at least in there to wait the 15 minutes. Some practices are still not using their waiting rooms and having folks wait out in the car anyway, so they're using that. If you do that, make sure that there's an MA or someone who knows what to do in the event someone goes down. You know, kids do that quick and with no warning, so just make sure that they're properly trained up there. You know, we've heard different things, but are curious, how are you addressing this? This is actually the CDC recommendation for all vaccines. It's just that it's always been really impractical for many offices to be able to do it. But for this vaccine, we're really trying. And of course, you can't force parents to stay there. If they want to leave, then they're going to leave. At least they're not, if they're not the ones getting vaccinated. And then how are you letting patients know that it's okay if we don't get you appointments tomorrow? So we just want to make sure that, you know, we're getting at TAPI and the health departments are all getting flooded with people as well. Like, my pediatrician said they can't get me in tomorrow. They're making me wait an entire week. So we are on your side and telling them it's going to be okay if they wait a week. They're going to be in a mask for another few anyway. So just know that we know that you're getting lots of angry phone calls, as you have been for 22 months or 22 years, depending on which side of the bed you woke up this morning. But we are on your side and trying to tell parents, do it as soon as possible, but do it in your pediatric practice if it's possible for you. Also getting some questions around standing orders. So would love to hear from folks about that as well.
Hi, this is Dr. Smith over at Yavapai Pediatrics. Can I chime in for a second?
Oh, yeah.
So I have been doing the COVID vaccine since January, and I set it up as a drive-up clinic. And I've continued that when it went to 12 and up and now 5 and up. And I've been doing it since Thursday. And it's working really well. So I wasn't sure if you're okay with me kind of sharing my little process so that other
Yeah,
people can
that would
maybe
be
try it.
awesome.
So what I do is I actually have a separate scheduling system through Calendly, which is the Google scheduling system, if anyone's familiar with that. I mean, obviously you can do it through your EMR as well, but I schedule people through Calendly, and then what they do is they just go to our website and they sign up, and I have it set up where people can sign up to 3 to 5 people per time slot. And then the time slots initially were only in the afternoon because the dosing was only available for 6 hours. So I had to limit it. So I wasn't, overdoing the time frame. I didn't want to, that being said, I did waste doses, you know what I mean? So I opened up vials, but I was just doing the afternoons. Now I'm doing it because the doses are good for 12 hours. I have it set up for all day from 9:30 until 4:30, and they can sign up at any time slot. What I do is then in the mornings, I print out the list of today's, and then they drive up on the backside of our clinic on the curb. I walk out the back door. So like, this is my window, and I just see people drive up to the curb, and I walk out and I ask them, like, I just do it in between patients. Frankly, I don't have the staff to do it, so I do it all. I don't think that's necessarily what other pediatricians want to do, but that's the way I've done it, and it's worked really well. When they drive up, I just go out, I get their consent, or I give them the consent form. I've already filled out the cards ahead of time. So like you can see for today, I'm trying to see how I don't know how to flip my camera because, oh, there it is. So like I have it like all set up and ready to go. And this is a 5 to 11-year-old, and this is a 12-year-old. So you can see it's a different, I color code it. My purple turned black, but anyways. But yeah, I have it all set up and ready to go. And then I drop one vial at a time, because I typically get about like 30 to 40 kids a day. And then I don't draw up the purple one until they actually get here, just so I'm not confusing those doses at all.
Oh, that's
Calendly has a program where you can send everyone a follow-up reminder. And so as soon as their appointment's over, they get a follow-up reminder with the same link that schedules them, that tells them to schedule their second vaccine. And so they do all the scheduling. I don't do any of that. And it works really well for the little kids. They're in their car seats, or they're in the buckle, or parents are holding them like in a very small confined space. They're outside, it's distracting. They're not in the doctor's office, so they're not anxious until I actually walk up to them with the needle. And the vast majority of them are actually doing fantastic. Like I said, I just walk out with a tray and I set it on the hood, and I give them their vaccine, and I put a Band-Aid on them, and they sit and they wait, and then they're off.
Did you choose to do Calendly because you're doing it for non-patients too, or?
Yes. Yeah.
Okay.
So I chose to do Calendly. And then, so without kind of like, you can see here, I print off my list every day, and then I just bold out the ones that are my patients. Here, I'll try to cover, hopefully it's blurry enough. I bold out ones that are my patients, and then I create an encounter for them in our EMR and bill them. I do anyone and everyone. If parents, the parents sign up, I do them. And then what happens is I know I have to go through my list, and the bold people get an encounter, which automatically connects to ASIIS. And the non-bold people, I go in, or actually my staff will go in and put them in ASIIS themselves. And so we'll go into ASIIS. So then we have 2 separate like to-dos afterwards.
Do you have anybody back there to watch them for observation afterwards? Or?
Yeah. So basically they're just instructed to honk on their horn.
Yeah.
So they're on the curb right by my office. I have my epi and Benadryl and steroids right here. I keep it right next to me in case anything happens, and ready to go.
Yeah.
Non-stop if you're in trouble.
So, and then there's myself, and Gary's here today. He's a PA, so he'll help me do it sometimes. Like if I'm seeing patients and there's a line kind of getting there, and my NP will help on days when she's here. And that's what we do.
Oh, cool.
Yeah. So they just honk their horn and let me know. And if they feel good after 15 minutes, they go. So
that's really helpful. Thanks for sharing that.
And I tell you, these kids, they do great. Like, I think being outside and being distracted, they do really well. Some of them we have to tie down, and parents hold them and I hold them and we get it, but the vast majority of them, we just really try to distract them, and it works really well. It doesn't interfere with my clinic flow because they're not even coming into the office. They don't take up rooms. They don't take up MA time, nurse time, which I think that's probably one of the things that a lot of us pediatricians are experiencing right now is shortage in staffing. And yeah, I just kind of do it in between patients and go out and get it done.
Thank you.
You're
Anybody have
welcome.
any other questions or have thought about doing that?
Get them when they least expect it.
I like one that's just squeezed in. That could certainly work in certain communities. And it might be something too to think about doing. I think we're kind of in a rush. You know, these first few weeks are going to be a big rush of eager parents, but then it's going to, I mean, we all hate to say it, but it is going to slow down. So, and a lot of parents are probably, you're going to convince them in your office and at their well visit, they're going to think about it for a week and then want to come back in, and you're not going to have room or MAs for them to come back in. So it might be something to think about doing, you know, after this big rush is done in some other communities. So that's great.
Yeah, I mean, we obviously, if people come in and want it, we give it in the clinic as well. So,
Yeah.
you know, I almost end every one of my visits is, are you guys doing flu shot today? And are you interested in the COVID vaccine? And my MAs screen them too. I've set it up in my EMR so that as part of their vitals, they have a screening question that if they're interested in the COVID vaccine.
Oh, cool. Thank you. Anybody else have stuff you want to ask or share or anything like that? We can kind of keep the line open for another 10 minutes, I think. Maybe 9. It's technically Macrina's day off. I had a question, Macrina, about, can you review the dosage?
Oh, okay, so for 5 through 11, it's 0.2. For 12 and up, it is 0.3.
But it's easier to just say orange cap, purple cap, right? Because you're not.
I just do orange cap, purple cap. I try to, everything's color coded. And
Orange cap,
that's
purple
the
cap.
easiest way to remember.
Yeah. If we are approved vaccine, if we are an approved vaccine provider, COVID vaccine provider, how can I get my account going to report? Oh, or do you mean your EMR to report to ASIIS? You mean your EMR reporting to ASIIS kind of automatically? You're going to want to contact the ASIIS help desk to get on the queue of practices to get that interface done with your EMR company, which I don't know what the wait is now. Do you know, Jen, what the wait is now?
It's taking a while, I think. It's less than it was in the beginning, but it does, there is a process for getting, you know, connected with HL7. You should be able to get an account or already have one to be able to report manually. I put the link in here for ASIIS just in
Thank
case.
you.
And for vaccines.gov, you also have to sign up with a provider account. I'll grab that, that link here. They've got some reporting guidelines and some tips on how to do that on the CDC website.
Yeah, we, if you are we know a lot of our family practices don't have that HL interface yet, but you know, if this is what can help you get it, it really helps us a lot to get all those adult records into ASIIS too for our own planning. And you know, Macrina would give you a big thanks in preparation for the next Hep A outbreak if we had more clear pictures of our adults in ASIIS. So, but it is taking a while. Anybody else have questions or comments or stuff that you're doing? Anybody have other ideas about how you're putting, where you having them go for observation for 15 minutes? That's like the $1 million question right now, I think. If you keep them in the exam room, remember to keep the door open, especially if you've vaccinated the parent.
Yeah, my office had us wait in the car as long as my husband was, you know, he was there, he drove. So We waited in the car and were told to honk the horn.
Sarah's saying, yep, just back into the waiting room with a timer. Do I have to report moving forward, or do I have to go back and report since the beginning? You need to go back.
ASIIS records, you go back. I'm not sure about vaccines.gov. It may just be what's your count today.
Yeah, we can find out about vaccines.gov, huh? What they should do, but for ASIIS, you're going to need to go back. When mixing the vaccine, why does the 5 cc syringe come in the supplies and not the 3 cc syringe for the 5 to 11-year-olds?
I'm guessing they just didn't have enough, and that's just how they, my guess is that's just because that's all they had at the time. I don't think there's any rhyme or reason or logic that goes with it. I just think they just sent the syringes that they had on hand and the supply they had.
Our pediatric practices are just so happy they're getting supplies, I think, a lot. So if you haven't started vaccinating yet, this is really different because you're getting, they send you all the stuff a few days before you get the vaccine. They're all very excited about that. We, like you, wish that would stay, but we're funneling our optimism into the end of the pandemic instead, I think. Oh, another question about, other training. So we are taking off for December and not going to do a tips training, but there is this 10 things that parents need to know about why we immunize. This is a quarterly training that we do for our health educators, social workers, medical assistants, anyone who works with families. But if you have we know a lot of you are, well, we hope that a lot of you are getting new MAs in. We know you have a heck of a lot of open positions for MAs right now, but this would be a really good training to send them to, in addition to the CDC storage and handling training, because it's geared more towards how do you talk to real people about vaccines, not all of the whole big system pieces and confusing things that your new MAs are going to be, kind of glaze over for. But please be sure to check that out. Oh, thanks, Laura. Administration syringe. The needle is already attached, so we have to use the same needle to draw up and administer. Macrina.
Correct. Yeah. And, we have been, the county health department, we've been using the Vantage Point for a really long time, which does not have a removable needle. So we've been drawing up and administering with the same needle for a very long time. And we don't see that it causes any more pain or any more risk of any adverse event in the arm at all.
Thanks. Any other questions?
Sorry, all of the code, I got another question about the codes. All of them are going to be posted on the website with today's presentation so that you have them and can share with your office the full set, no matter which vaccine it is.
Will this be on my VFC report card, the wastage? No, it will not be. It will not. Totally different thing. We know how hard it is for the pediatricians and folks who've worked in peds to look at that vaccine and throw it away. So, but we know it's like, but no. it's really important we not waste arms, and we know that it's a challenge and hard for you to explain to your staff. You know, we've heard a lot of pediatricians who have a lot of discomfort telling staff it's okay to waste that vaccine, but we're not wasting the vaccine. We're saving that life. We're protecting that arm. And you won't have to pay for it. It will not count against you. I know it's hard. I feel like we have to say it 900 times every day, but that's not going to count against you. Keep protecting your other vaccine. Nothing else changes for the other vaccines, federally provided, you know, VFC or private, but. Any other questions, comments, thoughts? We know this weekend's going to be a busy one. It's been really fun to go to those practices and see you doing these COVID clinics, and we're so appreciative of everything you're doing for these families. We are right there next to you to try our best to get these eager parents out of the way and make sure that you are as prepared as you can be to start offering it in well visits, because that's how we're going to get the numbers that we need. We know we need you to, anything we can do to help support you get through this so that you can have the brain capacity to think about how you're going to work this in to your workflows in the long term. We want to be able to help you do, because we're counting on you to do that. Parents want this vaccine from you. Not from, you know, all of these safety net things that we've been doing the whole rest of the COVID system around. So, but we will hopefully see some of you at 10 Things next month. Otherwise, call us, email us, text us, carrier pigeons, and we will see you in January. And probably be sure to take that survey so that we know what topics that you guys want to hear. Thank you, everyone, for what you're doing.
Thank you.